Good morning. My name is Lindsay Trainum, and this is my middle range theory presentation on the health promotion model. A quick look at what is to be expected throughout this presentation. We'll look at the vitals of the health promotion model, who created it, how it began, and its philosophical roots for its foundation. The actual model, its major concepts, and the stage of development will also be discussed. Finally, we'll look at some examples and how it is used in practice today. Nola J. Pender is a Michigan native that is credited with the development of the health promotion model. She acquired both her bachelor's and master's of nursing from Michigan State University, and then she chose to further her education at Northwestern University, where she earned her PhD in nursing. She is recognized as a distinguished professor at her alma mater and serves as a professor emerita for Loyola University in Chicago. Upon receiving her PhD in 1969, Ms. Pender began to study health promotion in the 1970s. At this time, she suggested that we look at the unhealthy behavior before the behavior actually develops into a chronic illness or disease. Her studies eventually led to the publication of the health promotion model in 1982. This model was later revised in 1996 with her help. Ms. Pender has also been a part of many other publications, including textbooks that are used today in nursing and other healthcare professions. The philosophical roots of healthcare promotion model. Pender's definition of health is both positive and comprehensive. Her definition includes the nursing meta-paradigms, the person, environment, health, nursing, and their relationships. In her 2013 Health Promotions Manual, Pender described her model as a, quote, multivariate paradigm for expanding and predicting health-promoting component of lifestyle. Nola Pender believes in a holistic and humanistic care approach where individuals can be studied as parts of a whole. She also recognizes the interaction between humans and their environment, which shape the individual into who they are, their behaviors, and in turn, the individual will shape their environment to ensure their needs are met. Nola Pender also noted that using the philosophy of health promotion to improve quality of life will also help prevent healthcare expenses from rising. How it all began. The health promotion model is derived from two previous nursing theories, the expectancy value theory and the social cognitive theory. The expectancy value theory looks at the way individuals engage in a current behavior and the actions they take in order to reach their goals, which could lead to positive health outcomes. The theory also states that people are more likely to work towards a goal that they are personally invested in and see as reasonably achievable. The social cognitive theory focuses more on thoughts, behaviors, environment, and their interactions between them that shape and change the way the individual thinks and develops behaviors. Self-efficacy is a major component of the social cognitive theory. It is defined as an individual's personal confidence in the ability to complete an action successfully. The more self-efficacy, the more likely an individual is to engage in a certain type of behavior. The health promotion model. The overall goal and purpose of the health promotion model is to assist nurses in understanding the determinants of health and its behaviors in order to use them as a basis for behavioral counseling to promote healthy lifestyles. The model uses both nursing and behavior science to describe and evaluate all dimensions of an individual and how they interact with their surrounding environment to pursue and achieve health. The model is often used as a conceptual framework in healthcare practice and evidence-based practice studies to improve health and the functional ability of individuals. The model is used in a variety of settings such as schools, work, homes, to assist in improving the health on all levels, from individuals, families, to communities. The health promotion model is used when planning for change, the change of unhealthy behaviors, and the development of interventions to promote a healthy living. The structure of the health promotion model includes 3 major concepts, 7 assumptions, and 13 theoretical statements. This is a visual diagram of the health promotion model. It represents the 3 major concepts, their subcategories, and the relationships between them. As stated earlier, there are 3 major key concepts presented in the health promotion model. The first major concept is that individual characteristics and their experience. Pender identified that the effect of the prior health behaviors are as important as the personal factors. Each person has unique characteristics and experiences that affect the subsequent actions, and these characteristics and experiences both help to shape the behavior of a person. The personal factors include biological factors like age and gender, psychological factors such as self-esteem, self-motivation, core values, and belief systems, and social cultural factors like education and economic status. The next major concept is behavior-specific cognitions and variables. This major concept has several subcategories. The perceived benefits of action or change, or what are the anticipated positive outcomes. Perceived barriers of actions. Ask the questions, are they real? Are the barriers imagined? Can the barriers be anticipated or possibly changed? Perceived self-efficacy. Resnick in 2017 defined self-efficacy as the judgment of a personal ability to accomplish a given task. Perceived self-efficacy in the health promotion model is defined as the ability to organize and execute a certain health behavior. Other subcategories are activity-related actions, interpersonal influences such as family, friends, providers, social norms, role models, situational influences, commitment to a plan of action. Pender describes the commitment to a plan of action as the actual intention to carry out the health behavior and what specific strategies can be used to make the plan successful. And then competing demands and preferences. Identify what alternative ideas and behaviors that are competing with the plan of action in order to be able to change the individual's behavior. The final concept of this model explores the health behavior outcomes. The model states that improved health, enhanced functional ability, and a better quality of life are among the anticipated positive outcomes of the model. The ultimate goal and the endpoint of the health promotion model is when the patient is now engaging in the health promoting behavior. Displayed on this slide are the 7 assumptions that are made by the health promotion model. It includes things like people are seeking to actively regulate their own behavior. They want to interact with their environment and transform it and themselves over time. Nurses and other health professionals are a part of the interpersonal environment, which influences people throughout their entire lifespan. There are also 13 theoretical statements made by the health promotion model. Health promotion model and practice. The use of the health promotion model relies on both the healthcare professional and the individual. Practicing health promoting behaviors is one of the best approaches to maintain health. Health promoting behaviors like diet, exercise, wellness screenings, and participation in vaccinations enable the individual to monitor their own health and ultimately improve the individual as well as community health. This model is used as a foundation for nursing and other healthcare professions as protocols and practice interventions. It also expands the role of the nurse in order to be a promoter of good health. It takes into account the individual's behavior so the nurse can develop a specific plan for a specific individual. The model can also be used among many diverse populations and settings with only a few areas that haven't been tested, such as using the health promotion model in an acute care setting. Stages of development. The model was originally developed in 1982, and it focused on factors that influence health behaviors in a general sense. The model was later revised in 1996 with the help of Nola Pender, and the theory was revised to focus on more specific influences that can be helpful in predicting a particular health behavior. The health promotion model was originally developed just to study exercise-related behaviors, and there have been over 38 studies that have been conducted using the health promotion model over the last 27 years. Dr. Pender has developed instruments of measurement for the health promotion model regarding the concepts and variables. An example of these are the Health Promoting Lifestyle Profile 2, which looks at the relationship between variables and behavior outcomes in order to improve health promoting behaviors. Another example is the Exercise Benefit/Barrier Scale. Further development is needed for the model. As mentioned earlier, the health promotion model is untested in acute care settings among urgent care needs and unstable living conditions. And while the model is diverse among age and gender, it has limited application to cultural groups and specific target populations. Practice makes perfect. When people hear the words health promotion, they think of preventative health screenings, early disease detection, and while these are important concepts of health promotion model is also used in other areas to look at specific diseases and specific situations. The model has been used to measure adherence to health promoting behaviors such as exercise and stress management versus the quality of life and well-being for patients with multiple sclerosis. In this study, the health promotion model was used in order to explain the concepts of adherence versus the concept of quality of life. In the study, quality of life was found to be more fully explained than the concept of adherence and suggested that multiple sclerosis patients rely on cognitive and emotional factors when thinking about quality of life. In another study, Valek, Greenwald, and Lewis discussed the psychological factors that are associated with weight loss and maintenance. Obesity is quickly rising above smoking to become the biggest health problem within the United States. This study uses the health promotion model as a framework to address the psychological factors and make suggestions of how a nurse practitioner should assess the problem, develop interventions, and come up with behavior counseling for weight management. Results found from the study show that using a holistic approach and interventions to maintain weight loss give the patient the opportunity and support for long-term success. References for the presentation have been listed on the following 2 slides. Thank you for taking time to listen and review my presentation of Nola Pender's health promotion model. I feel like this model is an imperative middle-range theory of nursing practice and is especially useful in practice development for advanced practice nurses. Have a great day.